ahead and get started. Make sure that you type your name in the chat box for attendance before we get started. All right. So before we get started, I got a couple things that I want to just kind of say to everybody. So number one, I know this week we don't have a test, like a weekly test. Um, but I just want you guys to keep in mind that when we do live lectures, you should at least try to kind of review some of your material before we get to the live lecture. Because number one, I guess what I'm trying to say is you should not be relying on the live lecture to be the only thing that you are either studying or reviewing before you take your test. We have other, other learning items in the course. We have the Rad Tech Boot Camp. We have, the PowerPoints. So you should not be solely relying on the live lecture to be learning the material. That's number one. Number two is the study guides that we provide, whether it's I provide you in this course or whether it's provided in your other courses. The study guides that we provide you all are a courtesy. They're not mandatory. We got together as a group of faculty and decided we would, do study guides for you all. But that's and the part of the study guide is that should not be the only thing that you're relying on to learn the material. So you should not just be coming into the week depending on the live lecture and the study guide to kind of get you through the material. If there's reference readings, of course, you should review that material, or chapters that you need to read. You should review that material. But there should be several things that you're using to help you learn the material. So it should not just be the study guide. It should not just be the live lecture. It should be the live lecture should only support what you're learning for the week. So supporting your reading or supporting the slides. And they should be reviewed. Both sets of slides should be reviewed and along with the study guide before you take your test. So that's just me on my soapbox for tonight. So we'll get started on learning the material for this week. Let me start recording.
Recording in progress.
Okay. All right. So, first we're gonna talk about some of the radiation protection standards organizations. And the textbook, the reference text this week reviews these, the second set of PowerPoint slides that you have kind of go over these as well. So first organization we're gonna talk about is the ICRP. But before we get into that, so what these organizations do is establish effective doses and equivalent doses. They establish limits for both of those. Then some of these organization make recommendations to limits that are established by either congressional acts or state mandates. And then once the standards are established, then the national and state agencies are responsible for enforcing them. So you have organizations that establish the limits. Then you have organizations that they look at those limits, and based off those limits, they decide whether they're gonna make a state mandate or they're gonna make a congressional act. And then once they establish those limits, the congressional or state mandates are put into place, then those national and state agencies are responsible for enforcing those limits. So here is kind of a summary of the organizations that we're going to talk about. We're going to talk about the International Commission on Radiological Protection, the ICRP, the National Council on Radiation Protection and Measurement, the NCRP, United Nations Scientific Committee on the Effects of Atomic Radiation, which is UNSCA, SCEAR, and then the National Academy of Science, National Research Council Committee on the Biological Effects of Ionizing Radiation, that's NAS, NRCBEIR. So this just kind of gives you a brief summary of their function. And these are the 4 organizations responsible for evaluating the relationship between radiation equivalent dose and induced biological effects. These organizations are concerned with formulating risk estimates for somatic and genetic effects of radiation. So first, the ICRP, established in 1928. Basically, they are the international authority on safe use of ionizing radiation, and they provide recommendations on occupational dose and public dose limits. This organization recommends, but it does not enforce. Then next, we have the NCRP, National Council on Radiation Protection and Measurement. This was established in 1964. It is a United States non-governmental and non-profit private corporation that reviews those ICRP recommendations, and then they make a determination if they want to incorporate those recommendations into the U.S. radiation protection criteria. They also do recommendations, but they do not enforce anything. And this is the organizations that set the ALAR principles. Then next we have UNSEER, which is the United Nations Science Committee on the effects of atomic radiation. They were established in 1955. And what they do is basically formulate radiation protection guidelines for sources such as radioactive material, radiation producing machines, and radiation accidents. Then next we have the long one, the NAS/NRCBEIR. So the NAS/NRC-BEIR. So this is an advisory group that studies the biological effects of ionizing radiation and risk assessment using routine or accidental exposure data. So we learned about Chernobyl, Hiroshima, Nagasaki. We've kind of mentioned all of those radiation events. So this organization is the organization that studies what happened, kind of follows those victims and their descendants. So that's what this organization does. The BEIR part, which is the biological effects of ionizing radiation, they formulated a BEIR report back in 1990 with health effects of exposure to low levels of ionizing radiation, which supersedes 4 of their earlier reports that studies biological effects on associated risk of these above mentioned accidents. So this is another kind of way to kind of look at these and break them down. You have your ICRP, it's International Evaluates Biological Effects, provides radiation protection guidelines, recommends occupational and public doses. Your NCRP, which is United States, reviews what the ICRP recommends, and then decides whether it's going to implement this in the U.S. radiation protection criteria. You have UNSEER, which is international. They evaluate human and environmental exposures. They look at epidemiologic data and research conclusions, and then they provide organizations such as ICRP with data, the research data. And then you have the NRC BEER, which is also international. They review the biological effects and risk assessment studies of those specific events that we touched on, and events similar to that. And then they also provide organizations such as the ICRP with that research and data of what they found. So next we move on to the U.S. regulatory agencies. So keynote are regulatory agencies. So first is our NRC, which is the Nuclear Regulatory Commission. This is a federal agency overseeing nuclear energy, the nuclear energy industry, formerly known as the Atomic Energy Commission. They have the authority to control the possession of atomic energy, the use of atomic energy, and the production of the atomic energy. And they also have the power to enforce radiation protection standards, but they do not regulate or inspect any type of imaging equipment or facilities. So what they do is supervise or design working mechanisms for nuclear power stations, help in production of nuclear fuel, handling expanded fuel, and supervising hazardous radioactive waste materials. They manufacture and use radioactive isotopes that are used in research industry, in nuclear medicine, and with therapeutic treatment. So if you work at a facility that has a nuclear medicine department, you probably will hear about the NRC, because the NRC does play a part in the nuclear medicine side if they use if they do different type of imaging procedures, and if they use thallium 201, which is a radionuclide. So agreement states. So the NRC basically enters into a written agreement granting specific states the responsibility of licensing and regulating the use of radioisotopes and certain radioactive material within the state. So if you see all the orange states, these are going to be those agreement states. So they have an agreement with the NRC that the state kind of handles the licensing and regulatory parts for the radioisotopes and other radioactive material. Then you have the non-agreement states, which are fewer states, but they're the lighter yellow states. And they work along with the NRC to inspect and enforce radiation protection guidelines. And then lastly, you have letters of intent. These states may legislate regulations above and beyond the NRC. And if they feel like they need to add an extra layer of protection on, they have the ability to do that. So specifically Texas, which you can see, Texas is an agreement state. It has the Texas Department of State Health Services, DSHS. It's been involved in radiologic health sciences since 1947. And what they do is strive to prevent unnecessary radiation exposure to public through effective licensing, registration, inspection, enforcement, and emergency response. So that's basically an extra layer of protection for you guys. So when you all get your license, you probably have to get some type of Texas state license saying that you were trained and you're capable of using ionizing radiation. Some states have an additional layer to that you have to have a state license. Texas is one of those. I worked in New Mexico. New Mexico is one. I work in Alabama currently. You don't have to have an additional state license. As long as you have your ARRT, you're fine. But in some states, you have to have their state license, which most times you're just paying a fee ultimately to get the state license. Now, some places, I know California is like this. You actually have to take an additional test, especially for people working in fluoro. So not only in order to get their kind of state license specifically in fluoro, you have to take an additional test besides just your ARRT registry in order to work those that machinery. So my suggestion is that when you graduate, if you ever decide you want to move to another state, make sure you kind of look over what that state's requirements are at the state level for radiography, because it may just be a case of you just paying to get your state license, but then it also may be that they're requiring you to take another certification test to get your state license. So always research that if you're gonna look into working and moving to another state, or either traveling, taking a travel assignment to another state. So next is the EPA, Environmental Protection Agency. They've been in the news lately, had some layoffs there in that agency, but that agency ultimately kind of helps with the radiation side of things. So President Nixon established this agency in 1970, and what they do is they are responsible for protecting the health and humans and for safeguarding the natural environment from industrial practices and harmful waste disposal. So they oversee the development and enforcement of radiation pertaining to control of radiation in the environments that have direct relevant federal agencies, environmental monitoring and oversight authority for areas such as action levels of radon. So on a bigger picture, they deal with more of outside radiation, environmental radiation, not necessarily medical radiation. They deal with environmental radiation. Next, the FDA, U.S. Food and Drug Administration. They work more than just food and drugs. They have a large scope of things that they work with and look at and oversee. Working in radiology, one part is mammography. The FDA has a big part in mammography because mammography is heavily regulated because of the type of imaging it is, and that you're looking for cancers, and your equipment has to be calibrated properly, and your settings have to be very precise because you're looking for cancers, and you never want to have machinery that's not working right that could possibly say somebody has cancer and they don't have cancer. So FDA plays a big part in regulating and manufacturing of mammography equipment. Have to do a lot of QC with mammography equipment. If it doesn't pass QC, if it fails so many times, the inspector has to come in, and if it ultimately does not pass, then they can basically shut your whole mammography program down. So FDA does not play. They do conduct on-site inspections. So if you work in a facility that has mammography, they do inspections. They come in and inspect your equipment. They come in and inspect your QA books, QA, QC. Every person that works in that area mammography, they have to keep their licenses on file. They have to have so many CEs for mammography. They have to have so many tests per year when they renew their license. So like I said, big deal with FDA and mammography. And they really do, they're looking for the occupational and occupational exposures due to faulty equipment. That's why they are really kind of really tight on that mammography equipment and making sure that it runs, because they are responsible for the protection of occupation and non-occupational exposure due to faulty manufacturing. So in 2010, the FDA produced a white paper, initiatives to reduce unnecessary radiation exposure from medical imaging, for us to make sure we do the right imaging exam, right time, radiation dose. We have a lot of different, kind of regulations or things that we have in place that we follow, or rights for our patients to make sure we're doing the right exam at the right time. We're always making sure we are checking the dose. A lot of our equipment now, equipment has gotten more advanced over the years. Pretty much it regulates dose for you. You don't really have to do your technique too much. It kind of, you pick a patient, you pick an exam, and it kind of pops up a technique. Before, some of this more modern equipment, as a technologist, you had to kind of know your technique. So while we were in school, we would make technique charts. So it basically gave us, we would make a range of kV and mass you could use for the extremities, for torso, for legs, and you kind of knew, using different equipment, what you need to set your technique at. But a lot of equipment now, you don't have to worry about that, because it sets it up for you. You may have to make minor adjustments, but for the most part, the technique it gives you will work for the patient. In conjunction with its partners, the FDA intends to take action to, number one, promote safe use of medical imaging devices, support informed clinical decisions, increase patient awareness, and optimize patient exposure to radiation from certain types of medical exams, and thereby reduce related risks while maximizing the benefits of these studies. So next is OSHA. When you think of OSHA, you probably don't think that OSHA is involved directly with radiology, but OSHA is the Occupational Safety and Health Administration. So they're going to be looking at more of your environment. Is your environment, your work environment, is it safe? But it does play a little part with regulating occupational exposures. It regulates the right to know concerning occupational hazards. So knowing about the hazardous substances that we're around, knowing about infectious agents we're around, knowing about ionizing radiation we're around, and then non-ionizing radiation such as ultraviolet and microwaves. OSHA usually does a lot of training programs in the workforce about safety, your safety environment, and what you're exposed to in that environment. So just another kind of breakdown, a summary of each. The NRC oversees the nuclear industry, enforces standards, publishes rules and regulations. With agreement states, they enforce regulations via state health departments. So agreement states has a second layer of regulation at the state level. The EPA, they develop and enforce radiation regulations concerning the environment. FDA produces radiation control programs, for example, with electronics, X-ray equipment, and then OSHA is going to monitor your employment industry. So monitoring your employee environment and the safety of that environment and what all you're being exposed to in that environment. So here's just another, just kind of a summary of those agencies we just went over. So next we're going to move into radiation safety program, radiation safety committee, and radiation safety officer. So I think earlier in the term, we talked about like our dosimetries and making sure that we're being monitored properly. Well, usually your radiation safety officer is going to be the person who oversees your radiation safety program. Your radiation safety programs, if you have radiation producing material or machines in your department, you should have a radiation safety program. The radiation safety program basically lays out that you must have the following: operational funds in your budget for safety of patients and radiation workers. They oversee the development of the policy and procedures that go along with radiation work, and then they provide equipment needed for starting and for continuing the program. So basically, your radiation safety program is going to be the kind of the people you go to when it comes to exposure, making sure you're safe. They work with nuclear medicine as well. They're going to work with other areas in the hospital that are exposed to radiation. So those that work in different areas of the hospital, like surgery, because we have to monitor all those people if they're working around radiation. So your radiation safety program is going to kind of be responsible for anybody who works in or with radiation or radiation producing equipment, or working in with radionuclides, like in nuclear medicine. So if you have a radiation safety program and a radiation safety officer, you should have a radiation safety committee. So what the facility you work at should establish this. It imparts guidance from radiation safety programs, and it is NRC mandated. So if you use certain type of radiation, radionuclides, radiotherapy, you have to have a radiation safety committee. Basically, radiation safety committee is there for you to report out any issues, report out any standards, and also to keep track of any changes that come down the pipeline that you have to change in your department, or if you have any type of radiation exposure, you have to basically you have to document that, the measures that you took to rectify it, patient education. If it was a nuclear spill, how did you clean it up? Like you have to be very documented in detail, and you have to keep reports of all that. So that's what your radiation safety committee is for. Next, like I said, if you have a radiation program and a radiation safety committee, you have a radiation safety officer. If you work at, like I said, if you work at a facility, if you work at like a small satellite facility, they may have at the bigger facility a radiation safety officer, and that person kind of covers you all at the satellite facility. Or if you work in kind of like a standalone at somewhere somebody is monitoring your radiation, or they have a radiation safety officer. You're at a standalone, it may be one person that kind of contracts out. But at the end of the day, you should have one. So your radiation safety officer oversees the program's daily operations. They provide formal review of the program each year. Usually a radiation safety officer is going to be a medical physicist, a health physicist, and a health physicist can be a bioengineer. It could be a radiology or another qualified individual. And they're designated by the facility and approved by NRC and the state. What that radiation safety officer is responsible for is developing radiation safety program, following internationally accepted guidelines, ensuring all persons, especially those who are or could become pregnant, are adequately protected from unnecessary exposure. Management must grant authority to implement and enforce policies. So they have to be able to implement and enforce the policies that they put or they decide to put in place in accordance to the guidelines that are there to protect us. They have to review and maintain radiation monitoring records for all personnel. So like I said, this is the person who should be collecting your badges, turning your badges in, giving you your new badges for the month, and should be able to give you your badge or your dosimetry report. Your radiation safety officer is your person who should be able to do that. And then in the event of questions, patients have questions, you all have questions, possibly overexposure, they should be able to provide counseling to those who receive, monitor, and deal with radiation, and making sure that all radiation exposure is within allowable limits. So next, we're going to talk about Radiation Control for Health and Safety Act of 1968. So what this act, what happened with this act, it was enacted by the Congress in 1968, and it was put in to protect the public from hazards of unnecessary radiation exposure. So we know we have environmental exposure. We know radiation exposure does come from different sources, such as electronic products, microwave ovens, the TV, and of course, our equipment that we use. The act permitted formation of the Center for Disease and Radiological Health, CDRH, under the jurisdiction of the FDA to establish standards for the manufacturing of imaging equipment, installation of imaging equipment, assembly of imaging equipment, and maintenance of imaging equipment. So basically what it says is that, you know, there has to be standards in place for people who make equipment, for people who install our equipment, assembling our equipment and maintaining our equipment. If you've ever been in a department and they've replaced equipment, you know, you have to get somebody in, skilled person to come in and kind of break the room down, take the equipment down. Then you have to go in and make sure that the room is still protected, lead wise. Then you have to, when the new equipment comes, you have a group of people who come in and they will install the equipment. The equipment has to not only be put together, but then installed in the room. And then making sure the physicist checks the equipment, but once it is working, and then make the maintaining of the equipment. So QCing the equipment, doing the PMs, you know, checking the equipment quarterly, yearly, however often you have to check the equipment to make sure it's still in good working condition. And then if the equipment breaks, calling the proper people out to have the equipment